It's time for another segment of Mr. and Mrs. Medicare, saving seniors from a high cost of healthcare, debunking Medicare, making Medicare easy to understand for all seniors. All guests of any of the Medicare segments receive the free ebook written by your MedicareLady.com. Here are your hosts, Paul and Sarah Finkelstein.
Hey, have you gotten around to Medicare, to really investigating and researching Medicare, Medicare for the your senior community, your loved ones, those that are having a milestone birthday at age 65, started in 1965, focuses on health care for seniors that are 65 years old. When's a good time to check it out? Well, at a minimum, say 3 months before your 65th birthday. If you haven't gotten around to it, perhaps maybe you need one of these. Let's talk about Medicare, your free Medicare dose of lesson, your free lesson on Medicare, your daily Medicare lesson, absolutely for free by Mr. and Mrs. Medicare or Paul and Sarah Finkelstein, realmedicareman.com and realmedicarelady.com. My wife Sarah wrote this amazing book. It's straight to the point. Finally, an easy Medicare education for boomers and seniors. The conclusive, clear, and complete guide. Make no mistake about it. The roadmap to Medicare is now here, brought to you by realmedicarelady.com. So let's talk about chapter 11 of the 16 chapters in this book. 16, by the way, chapter 16 talks about the most commonly asked questions about Medicare. So wait till you hear that section and the 3 parts to this daily Medicare nugget of information that will save you and your family tons of money, tons and tons of money. If you don't get this information, your healthcare situation financially could be in dire straits. So what is a Medicare supplement plan? And that is the daily free nugget of Medicare information in about a 5-minute nugget. A supplement plan is designed to work hand in hand with original Medicare. Part A and Part B is original Medicare. People who want to control the flexibility that original Medicare offers will purchase a supplement plan, a Medicare supplement plan to protect their financial exposure. By the way, the other term for a supplement plan is a Medigap plan. So they go hand in hand as well because it covers the gaps in Medicare. So a Medicare supplement equals a Medigap plan. Parts of Medicare are designated as follows: Part A, Part B, Part C, and Part D. D's for drugs. Medicare policies are designated by a letter. The letters are A, B, D, G, K, L, M, N. And those are called plans to the Medigap. Medigap Plan A, Medigap Plan B, etc. All the Medigap policies are standardized. What does this mean? Is that a Plan G is a Plan G regardless of which insurance carrier you select. The coverage is identical from one carrier's Plan G to another carrier's Plan G, but frankly, your physicians don't care which carrier you select, but it makes no difference to them. They get paid exactly the same. A Medigap policy must follow state and federal laws, and they are guaranteed renewable, which means that you can keep your policy forever as long as you pay your premiums on time. They can never cancel you or charge you extra just because your health may be declining. All Medigap policies cover an additional 365 days in the hospital. After Medicare's limit of 150 lifetime days in the hospital. Okay. Supplement Plan G is the most popular and comprehensive supplement plan as it pays 100% of all the Part A deductibles, co-pays, and co-insurance. And your Part B co-insurance, once you meet the Medicare Part B annual deductible, $233 in 2022 when this book was written, as well as excess charges if they're applicable. It's a little bit more today in 2024. When you turn 65, you have 6 months after your Part B effective date to sign up for a Medigap policy without having to answer any health questions. The supplement plan premiums vary by zip code, age, smoker, non-smoker status, and gender in most cases. Prior to 2020, the most popular, most comprehensive plan was Plan F for new Medicare beneficiaries. It's no longer available in new Medicare beneficiaries, but anyone who had it prior to 2020 is grandfathered in and can keep it forever. There's no out-of-pocket cost in Plan F, as the plan pays all co-pays, co-insurance, Medicare deductibles on Part A and Part B. Every Medigap policy covers the 20% co-insurance of Part B. Well, we've reached the end of this nugget in this amazing book here, Chapter 11, all about supplement plans when it comes to Medicare. Well, I did promise that would reach about 5 minutes worth, but we are going to talk about the most commonly asked questions when it comes to Medicare. So let's see if we can turn to some commonly asked questions. This is actually one of my favorite, most commonly asked questions. I've asked it in prior daily free Medicare advice, nuggets, etc., all about Medicare, because how do you eat an elephant? One bite at a time. How do you learn Medicare? Chunk it down, one little lesson at a time. If you need further assistance, Medicare Lady is standing by. Real Medicare Lady is standing by. You can always reach her. Her voicemail is always activated. She'll reach you within 24, 48 hours at 561-302-5760. That's 561-302-5760. That's realmedicarelady.com or realmedicareman.com. That's us in the picture right there. So here's a commonly asked question for you. What if I'm still working beyond 65? Do I have to go on Medicare? And hey, this could be possibly a way that you could save on some of those premiums if you're not getting the Medicare Advantage plan or Part C. If you get a supplement plan, etc., you don't have to go on Medicare 65 if you have credible coverage at work. What's credible coverage at work? Well, that depends on the size of your employer. If your employer has less than 20 employees, then typically, yes, you better go on Medicare. And besides, even if your employer does have a credible coverage plan, there are plans out there that might be costing you more than Medicare. I've seen it. So definitely talk to realmedicarelady.com or realmedicareman.com. I'm Paul, my wife Sarah. That's our pictures over there. I haven't worked the minimum of 10 years. Can I still qualify for Medicare? Well, you can qualify for Medicare through your spouse. So, hey, it's cheaper to keep her, perhaps, having a spouse. If you need some actual advice on dating, I could help you there too, because I met my spouse online on April 18, 1998 at 10 o'clock in the morning at Denny's over a cup of coffee. The most expensive cup you could buy a coffee that they no longer have at Denny's. But anyway, I have some more information I want to share to you, because if you don't have this information in time, your health, financially anyway, could be in dire straits. So here's some really good advice for some real live testimonials, real kindness from real people, real testimonials. Let's see what Joe and Marion Clemente said. And I quote, they said this about yourmedicarelady.com and directed towards Sarah. They said, thank you for your help with understanding and choosing your supplementary medical insurance. We've been very nervous about retirement and when it comes to feeling secure about health coverage and getting our medications. But you made us feel safe, secure about our choices. And thank you again for your patience and your time. Joe and Marion Clemente, thank you so much for talking about those kind words. Real people, real testimonials, Joe and Marion. Also, one more, Luz and Carlos Vasquez. What did they say about your Medicare Lady? I would like to take a moment to thank you for your services that you have provided for my wife and I. You were helpful, responsive, in answering your questions about Medicare. It will be a pleasure to refer to you. You are good at what you do by listening and caring. You have 2 ears and 1 mouth. You listen and you care. Thank you so much. And Luz and Carlos, we really do appreciate. And that is in this great book. Down below, you just saw the button. It tells you how to get a copy of this free book all about Medicare. You can read it on your own at your pace at easybuttonformedicare.com. That's easybuttonformedicare.com. You can spell it. You can do it. easybuttonformedicare.com. I'm Paul Finkelstein. I'm realmedicareman.com, and my better half is realmedicarelady.com. She is standing by to help you on the phone and give you the best bedside manner possible in the Medicare industry or any industry. We're here to help you. And her number is 561-302-5760. That's 561-302-5760. Thank you so much for joining me here today. I do want to make sure that I give Tony Raimondo the last word for today. Why do I give Tony Raimondo the last word for today? Because if you know somebody that's a business or non-business or nonprofit that's looking for the best voiceover on planet Earth, you need to look up Tony Raimondo. You can find him at trcvoiceovers.com, trcvoiceovers.com. Here is a sample of what Tony sounds like.
It's time for another segment of Mr. and Mrs. Medicare, saving seniors from a high cost of healthcare, debunking Medicare, making Medicare easy to understand for all seniors. All guests of any of the Medicare segments receive the free ebook written by your MedicareLady.com. Here are your hosts, Paul and Sarah Finkelstein.
And since you made it to the end of this video, you're still here. That means you have a round to it, and you're going to get to it. About taking care of your Medicare. If you're age appropriate, if you're at 65 years old, call us. We're at realmedicareman.com or realmedicarelady.com. You have the numbers, all the information in this video down below. Thanks so much. And also, I do want to thank all of those that listened to yesterday's Daily Nugget about Medicare, because at the very end of that video, I said, don't forget to vote. And you heeded, and you did it, and we did it. And thank you so much for voting in yesterday's election. See you in 4 years where I remind you to vote again.